Saturday. I want to thank Lady Shulman and welcome her as our new executive director, and thank all the people that are involved in putting this together. I heard you guys had some AV problems this morning, but luckily there's no AV. There's no visuals in my presentation. The only visual is me. But I want you to visualize something. I want you to look at my face. And throughout my talk, I want you to just imagine my face multiplied by 190 million. 190 million women on a cold, chilly October Saturday. 190 million young girls who are doubled over in pain. 190 million girls who maybe get sent to their school nurse who doesn't know what's going on, or gets teased by her younger or older sibling to get out of the bathroom because they take up too much time, and don't get believed a lot of times by their general practitioners or their parents. And not all cases are the same. I'm going to talk to you about mine this morning. So, but yes, the good news is I brought lunch. So after this we do get to eat. I got my period when I was 13 years old. I got it on my 13th birthday, so that was a great gift. Kind of, not. And so I got my period, and it was very thick, and I was prepared for my period because my mother, who is also a nurse, who helped me with the idea for this conference a few years ago, she told me that I would probably have trouble when I had my period. By trouble, she meant swelling, bloating, what she called emotionality. What I now realize was just a reaction to chronic pain and hormones. And chronic pain, headaches, backaches, cramps, numbing. And over the years, all of what my mother said came true. So I didn't really think about it that much, because when she talked to me, she gave me that talk that all parents give their children about the birds and the bees. She said, you know, this is just your lot in life. Some girls get pain and some girls don't. And I had pain, so you'll probably have it. So I was expecting it. And over the years, over the months, all through high school, it got heavier and heavier and heavier. If you were my school nurse in my high school, you could have known that I had endometriosis even if you never laid eyes on me. All you had to look at was my attendance record. And you would have seen that I was missing from school, from track practice, from school dances, from class projects, 4 or 5 days a month. It's almost 25% of my education that I was just absent for, not there. And that's not even talking about the ways that it affected me emotionally and physically and mentally. That's just academic. That's just social. Because endometriosis, you've had ample visuals about how it actually occurs in the body. Because it occurs and develops in the body, when a young woman is becoming a woman, it becomes part and parcel of how she feels about her body, about how she feels about herself and her self-esteem. It's such a tender and vulnerable time for most of us to layer on top of it a condition like this that you really don't want to talk about. Is very traumatic, not only for the young girl, but for everyone who she loves and for everyone who loves her in her family and social circle. At the EFA, we like to think of this not as a woman's disease, we like to think of it as a family issue. Because when a woman is down with pain, everyone in her household suffers. Think about when you guys miss work, because you're sick with the flu. And I'm sure there are women in this room who have endometriosis that know it, and I'm sure there are women in this room who have endometriosis who have not been formally diagnosed. but I would guess you have some suspicion of it because you're here for a start. So I went through high school, and I went through all of that, and I got to college. Sharon is my college roommate. She and I went to university together, and the pain started getting worse and worse and worse. And I remember being in tears, we had a big, beautiful kitchen for a college apartment, I must say. We were very lucky. But I would say, Sharon, please go get me a heating pad because my heating pad broke. Please can you go to the pharmacy and fill this prescription out? And Sharon will tell you she thought it was a little bit dramatic or histrionic because I was in so much pain. And it's hard sometimes to accept why things happen for a reason because, my roommate, Kelly, was taking 2 Advil, putting a Tampax in her back pocket for later and going off to basketball practice when she had a period. And I was literally doubled over in my bed. And the only reason I would get up was to change the towel under my backside because I knew I would leak again. It's very embarrassing to talk about this when you're 14, when you're 16. When you're 35 or 40, it's hard to talk about it. But you have to talk about it because the only thing that I have now understood about my own condition and about my own pain that I suffered for decades is that the reason I had the pain was to be here today. It must have been. To hold this mic and to talk to you and to talk to another group of women and hopefully that they will pay it forward. The one thing I want to ask you guys to do is if you wouldn't mind, after leaving these doors today, within 1 week, it's Saturday, okay? So next Saturday is November 2nd. Within these 7 days, please tell 7 people. Just tell 7 people. You have Facebook? Put it on Facebook. You take a picture of the poster, send it out to people in your email list. Talk to other nurses who are colleagues of yours who have not gone through this program or who are unable to be here today. Maybe go back to your practices or your schools and look at the attendance records of some girls. Ask your colleagues, say, are there any people women that are missing, young girls that are missing? Because that becomes very important. Sometimes the young girl just needs somebody to say, this isn't right. Can I help you? And it's astonishing to me that I went undiagnosed until I was 36 years old. But that's the truth. I had very good health insurance. I was very blessed and lucky to have that. There were medical professionals in my family. My mother was a registered nurse. She worked at Sloan Kettering when I was young. And yet I went undiagnosed. I had access to the best medical care in Los Angeles or London or New York, wherever I was living at the time. And I continued on this way, went to college, started modeling. And in my modeling career, too, I would have to time out in the calendar and see when my period was coming. And I would have to tell my agent, I'm sorry, I can't do that shoot. Because I knew I would have my period. I was scared if it was a bathing suit or something that I would soil, the samples at work. It was incredibly embarrassing. And the last thing you want to do is call your colleague and call in sick again for a condition like this. So I'd make up excuses. I didn't always want to say I have my period. So I'd say I have a headache, or I have the flu, or I have a personal emergency, or I have a family emergency. I lock myself in the elevator. Anything so that I didn't seem like a chronic problem. Because if they understood that this was a chronic problem, then I knew that I wouldn't get looked at the same way for jobs. Pretty girls are a dime a dozen. And I knew that there were 17 models who were willing to do my job, and all he had to do was go down alphabetically. It already took him half the alphabet to get to me. So I hid it a lot of the times, or I diminished the scale of its effect on my life. Then we're going to flash forward to my 30s, and I think I was 33, and I was living in Los Angeles, and by the way, all this time I've been going on regular gynecological exams. I mean, a regular, I mean, probably once every year, once every 2 years. Nobody said to me, why are you taking a handful of Vicodin every month? Nobody said, gee, Tylenol 3 with codeine every 2 hours, you know, or maybe we should check this out. Nobody said it to me. I had gynecologists who put me on birth control to try and, as they said, suppress your symptoms. And it did suppress my symptoms. But I think for me, that was not a blessing. Because all it did was mask the problem and delay me having to deal with it. And so the disease grew and grew and grew, like rings on a tree, like weeds in a garden. You know, I wanted to call the foundation the Healthy Womb Society. Because I thought endometriosis was such a long word, you know, it wasn't very appetizing. But I think it's good that we called it the IFA, because we need to say it all the time. You know, like supercalifragilisticexpialidocious, we need to say endometriosis, 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 so that people understand the word, they're familiar with the word, they know how to pronounce it, they know what it is, and they know how to treat it, that there is treatment. And I was on birth control for most of my 20s, and then I went off birth control. And I had all kinds of problems with birth control. You know, it would give me pregnancy spots. It had all kinds of collateral effects. But the biggest effect that it had was it delayed me actually dealing with this disease. It gave me another instrument by which to shove it under the covers, put it in the drawer, and away until next month when it came. It's almost like an alcoholic who doesn't want to admit they're an alcoholic, and they, you know, put everything away when they're sober, and then the next month it happens again. I just didn't know what to do. So finally, I had really bad cramps. I went to see a doctor in Beverly Hills, and he performed a surgery. Listening to Dr. Sechkin's presentation about, you know, the endometrionic cysts and stuff, he told me, you have 2 cysts in your body, in your ovaries. I'm going to remove them. One is endometrionic, or blood-filled, he said. But he still never said the words to me, you have endometriosis. It's a condition. You have to check it out. You have to maintain it. It's not normal. Because it wasn't normal. Pain is your body's way of telling you something is wrong. The only patient worse off than a stage 4 endometriosis patient like me is the one who presents as asymptomatic, who doesn't have any pain and doesn't know anything is wrong. That is terrible. And my guess, I knew something was wrong, and all the people around me did too. They were just dealing with the superficial aspects of it rather than the cause. And so I had the cysts removed, and fine, okay. And he said, everything should be fine now, literally. He said, you'll be okay now. And it wasn't. Slowly the cramps started coming back, slowly it started getting worse. And then one day, on my 2nd wedding anniversary, I went out to dinner with my husband. I didn't want to go, but it was our anniversary. We made reservations, beautiful restaurant downtown. We went to dinner. It was, increasingly, my lower back was hurting. But it wasn't time for my period, so I didn't think anything. I asked the maitre d' for a pillow. You know, because it's me, they gave me all these dishes from the kitchen that I didn't ask for. It's the only high-class problem I have with being on Top Chef. And, you know, I kept, like, saying, okay, let's just muddle through. And we went home, and I said to my husband, I said, something's wrong. I really have cramps. I don't feel well. You know, my lower back is radiating with pain. I don't know what to do. And he thought that I was just exaggerating because I didn't want to be intimate. I didn't want to be romantic. And we had a fight. Not the first, not the last fight. It's very lonely for people who love people with endometriosis. Now, looking back on it, you know, 6 years after, I wonder what our marriage would have been like if I didn't have endometriosis. And so, I called my doctor, and, you know, I have a very nice doctor. He does make house visits. And he said, listen, I'm out in New Jersey. Drink some mint tea, because mint is an antispasmodic. I said, we are way beyond fucking mint tea. I'm sorry to say it. I mean, I was literally like, I felt crazy. I felt my scalp itching. And, you know, 4 slammed doors later, across, you know, my stepson's room, he's sleeping there, I'm sleeping there, I'm on the phone with Dr. Primus. And he said, if you can just hang on, I'll be there in an hour. Let's stuck in traffic. I said, I need to call an ambulance. I'm scared. This was like midnight. And he said, if you call an ambulance, New York State law, they have to take you in to the hospital. I don't want you sitting in the emergency room for 6 hours. If you don't know what it's going to be like. And I said, I can't stand it anymore. I called the ambulance. The guys came. Dr. Primus got there. He can see I'm in pain. He can see, because he knows. He said, okay, he said, I need to give her some pain medication. I said, no, you cannot give it. We cannot give it. He said, okay, I'll follow you to the hospital. To go to the hospital, I meet a great doctor who's very sweet, who was a gastrosurgeon. And they try to make me drink something and take the scan, and I throw up all over the scan. It's horrible. My family's being called from Connecticut. Everybody's rushing to the hospital. The only satisfying brief moment was I said to my husband, you believe me now? And this doctor did a gastrosurgery and he laparoscopically, and he came to talk to me after. All my family members, a sea of brown people in the waiting room, they saying, what's going on with her now? And he said, I see you have a scar on your arm. He said, we went in there. He said, there's a little piece of scar tissue that had wrapped itself around your small intestine. And we don't really know why the body produces scar tissue. It just does. Maybe it's scarring from the ovarian cyst you had removed a few years ago in Los Angeles. And I think it has been there for a while because I lifted it up, I snipped it, and the intestine should spring up, but it didn't. It had still remained depressed. It's like stepping on a garden hose. He said, so I had to massage it. So all that food that I had been eating was backed up. And that's why it was throwing up, and nothing could pass. My system was completely blocked. And he said, but now you should be fine. Now everything should be fine. It's okay. Nothing was fine. I truly believe that that doctor who's here on the Upper East Side gave me the best care he knew how to give. The care he would have given his daughter or his sister or his wife or mother. But he's a very established, amazing doctor. He went to medical school 40 years ago. They didn't teach you that much, especially if you weren't a gynecologist, about endometriosis. Which is why conferences like this and the medical conference we run is very important. I believe that every doctor should know about endometriosis. Any doctor working in the body cavity, because it becomes misdiagnosed so much. Diverticulitis, My mom had her appendix out. She now believes it was because of endometriosis. They just didn't know what to do back then. So I said, okay, this time I'm going to be fine too. Wasn't fine. Then I was at a photo shoot for my cookbook. And I started bleeding in the middle of my cycle. And I didn't know why. I sent the assistant out to get me a Tampax just so I wouldn't. So I knew we only had the location for the day. I had to do the photo shoot. And I wasn't in pain, but I was having this weird bleeding. So I just, again, tried to stop the problem and move on. Tried to shove the problem away. Put a Tampax in. Tried to, smile and do the picture like nothing was wrong. Then finally, after the shoot, I took out all the bunch of tissues to him, called Dr. Primus. I said, this is what happened. I don't know what to do. He said, you're always complaining about cramps. He said, since I've known you, if you can't get a hold of your gynecologist, I'm always giving you medicine. I'm always seeing this as a repeating pattern. He said, I'm very worried. He said, please go see a friend of mine and tell him, that I sent you. Tell him that I'm worried about you, and I'll talk to him too. It was October of 2006. 2006, October. It was a chilly day like this. I'll never forget the day. I had a big day of appointments, starting at 5:30 to be on the Today Show, and ending at 6:45 by going to a fashion dinner at Bergdorf or something for a friend of mine. And in the middle of this, I had made this appointment at Dr. Sechkin's office, and I went there, And I remember I had, you know, like all of us, we have a million things a day to do, so we try and like multitask. So I was like, okay, if I wear my evening gown, I can go to see Dr. Setch and I can go straight to Bergdorf. So I'm sitting there twinkling in my little cute cocktail dress, my boobs all up to my chin, waiting to see Dr. Setchkin. And I go in and, you know, he says, come into my office, and he's asking me like 3 pages of questions. And I'm thinking, I already filled the 14 pages that you have to fill on the clipboard before I got to you. So I'm like, fine, looking at my watch, okay. Then he takes me to the examining room. He and his nurse examine me. He asks if he can do a rectal exam. I've never had a rectal exam. I highly don't recommend it, if you can avoid it. And so I was like, okay, that's weird. That was the first sign that something was not at all okay. But little did I know that was the first sign of hope, when somebody actually went the next step rather than just pulling out their prescription pad. And he said, okay, Miss Lakshmi, please get dressed, come to see me in my office. And he closed the door, and I asked him, I said, Dr. Setch, can you please tell me, is this going to take a long time? Because I'm a little bit late. I have this dinner, and I'm thinking, it's not that far from his office to Bergdorf. There's enough time that I can maybe put lipstick on and like just clean up under my eyes. And he said, no, Miss Lakshmi, this is going to take a while. I suggest you put down your cell phone. He said, I believe you when you think you are telling me the truth to the questions that I asked you before I examined you over there. Because you were standing on your own 2 feet and you walked in through my door to my office. But your anatomy and your story does not match your life. And I don't know why you're not on the sidewalk, on the floor, writhing in pain. So I think you have sublimated your pain so long and so well and so professionally that you don't know you're in pain anymore. And you are functioning at a level that is really unconscionable, is the word I believe you used. I don't believe you when you say everything is normal at home with your husband. I don't believe you when you say you have mild gastric problems. And I don't believe that nobody ever detected this in you. Did you go to the doctor? Do you just have your GP give you meds? How many gynecologists do you have? Who is your last gynecologist? Where do you live? Why did this guy do surgery? What's his name? Did he do this? Did he say that? And I said, well, is it a big problem? Like, what do we do? He said, yeah, it's a big problem. It's a really big problem. And I said, well, how long, what do we have to do? He said, we have to operate right away. I said, oh. I said, well, that's not going to work. I said, well, when do we have to do that? He said, no, immediately. So again, I have this mechanism of compartmentalizing everything. So I said, okay, this is in October, like now. I said, what if we do it the Wednesday before Thanksgiving? You know, because then I figure, A, none of my family will have to take off from work. They'll already be off. And B, I won't really be missing from work because everybody will be off. Because he said, you'll probably be maybe in the hospital overnight. You'll probably be in bed all weekend. But within a week, you can go to the gym and go to your desk, go to the office. I said, okay, great. So we prepare. I said, I want to do the Wednesday before Thanksgiving. I had it here. And he said, I think this surgery should take about an hour and a half, but we'll see. Dr. Setchkin was in surgery with me for 4.5 hours. Talk about kidneys and stents. I had those. I had stitches in 4 major organs. He did 19 biopsies, of which 17 were positive for endometriosis. He scraped out of me what was blocking things, and a lot of what you saw. I always have the suspicion that you're showing them slides of my body, and I don't want you to do that. It's very hard for me to watch. It's really hard to get up here and talk about your career. To you guys, not so much, but I mean, in general, you know, nobody wants to talk about their vagina. But I do it all the time because I hope that, there are all those 190 million faces of the next generation of girls who won't have to go through what I did. So I had that first surgery, and I wasn't up after the weekend. And I wasn't back to work or the gym in a week. That was Thanksgiving. I was in bed, lying in my bed until February. That's how much it affected me. I was weak. My mother flew in from Los Angeles, and then she flew out. I think she was still working at the time, she was retired. My aunt flew in from India to take care of me, to relieve her. It just was, and when you have that many weeks to lie on your back and look at a white ceiling, it really makes you think about your whole life. You have no choice. A lot of time on your hands to let your mind wander. And I started to think, why the hell wasn't I diagnosed? Why didn't somebody see what was going on? Why didn't my mother tell me not to be scared? It's very scary what happened to my body. Why did every gynecologist say, it's not really, you don't want to be on Vicodin or Anaprox or Naproxen? I know all of the trade names for all of those kind of medicines in any country I lived. As a model, I lived in France, I lived in Spain, I spent 6 years, most of my 20s in Italy. I can tell you all of the names. They make this. Naproxen is horrible. Anaprox made my stomach burn. Vicodin gave me constipation like you wouldn't believe, and nausea and headaches. But nobody said, what is causing this and what can we do? And once I had that operation, things got a lot better. And he told me, he said, I may have to go back. It's just I got scared. He said, at one point, you know how he talks, you've heard him talking. He said, at one point I was lost in your womb. I didn't know where I was. I took a left turn and then I was lost. He said, this is connected to that, that is connected to this. None of it should be connected at all. And, there's a path, and now I'm off the path. I was like, okay. So the anesthesia has worn off too much for this conversation. And then I got back to my life, and then slowly things got better, and I had another surgery with Dr. Sechkin. After the first surgery, he came to my bed, and he said, do you know that your left ovary, part of it, is really not there? And I didn't know that at all. Nobody told me that. And he said, I saved your right fallopian tube, but I want to tell you that I don't know if I'll be able to in the long term. I'm leaving it for now. We're going to do another follow-up surgery because it's such a stress on the body. I mean, he did it laparoscopically, but still, you think about all that intricate cutting, I always like to think of the womb as a garden, where life grows. And endometriosis is like weeds in a garden. So you have to get a doctor who's patient and thorough and a perfectionist who really wants to go behind the bushes and behind the fence and under the rock and around the flowers so the flowers stay intact. The fruit trees still blossom, but you have to get every last thing out, even if you don't do it in one go. Because like weeds, it comes back. So I had, 2, 3 surgeries. I had 5 surgeries total, including the cyst surgery, including the gastro surgery that really just was the tip of the iceberg, we now know. And, I went through a divorce. I got divorced in 2007, and 2008, I think, Sechkin and I were talking about starting the foundation, or they had done something, for patients before I got here, so I have to give credit to all the people that were with Dr. Sechkin before I ever met him. And then we decided, okay, let's really launch it and stuff. And in that process, he said, I really want you to talk to young girls. I have this patient, and she saw you walking out of my office, and she really loves Top Chef, and she's very scared. Can you just talk to her so she will be, she'll feel like somebody who's on the other side who can understand her. And then we started doing this kind of privately, and then we started doing it, thinking about starting the EFA. And during that time, it was a very lonely time for me because for 6 months I was living at the Surrey Hotel uptown because I was going through a divorce, and I just called it the Sorry Hotel. Sorry. So sorry, I have to go, sorry. And so I was at the hotel, and then I moved into my little apartment downtown, and he said, what are you doing about your fertility? I said, well, I don't know. And he said, you're 38, you're going to be 39, whatever. And I said, you're right. I said, let's freeze my eggs. By this time, he had to remove my right fallopian tube. Okay, so my left ovary was shot, my right fallopian tube was gone. Basically, rabbit ears were holding it all together. And so we went to a very swanky fertility place, up on Madison Avenue, and I met with a doctor, and they make you do all of these tests when you want to freeze your eggs. And not that it's covered by insurance. Talk about Sweden. You should be in Manhattan. You don't know how hard it is here. So, and in the process of doing all those tests, I got a call from the doctor who said, Miss Lakshmi, I'd like you to come in. I want to talk to you. I said, no. I said, you talk to me on the phone. I'm very busy. What is it? And he said, your ovaries, he said, I got your results back. I said, okay, tell me what I have to do. He said, your ovaries are older than you are. I guarantee you, no matter how good you're feeling, and I wasn't feeling that great about my 40th birthday coming, you never want to have someone tell you your insides are even older than you are. And he said, I think there's going to be a 10 to 15% chance that you're going to ever be able to get pregnant, even with IVF. And I said, well, what about naturally? He said, I don't think you have a very good chance at all. I said, define not a very good chance. He said, in my professional opinion, I would be incredibly shocked if you got pregnant at all. So we froze my eggs. I still think about those 3 little guys in some fridge somewhere, there, my little seeds of hope. And I was devastated. And first I was really just shocked and sad. And then slowly, they began to rise up in me, almost like gastric acid. Literally like a burning red swirl that came up and came up and came up. And it was like that when I was bedridden after the first surgery. I started getting really angry. I started getting really upset. I started saying, why is this happening? And I remember years ago I had tea once with Jesse Jackson. Whatever you may think of Jesse Jackson, the Reverend Jesse Jackson, I want you to know when you're one-on-one with him, he still talks in rhymes. He does. He does. He still talks in those, these kind of limericks. He's very poetic. And I'll never forget one of the things he said years ago. He said, as a black community, as people, we have to turn our pain into power. And I thought that was such a great turn of phrase, and that always stayed with me. And in this case, my pain had turned to anger. And I really didn't know anywhere, I didn't have anywhere for that anger to go. And so I called Sechkin, and I was in tears. I was literally like blathering, and I told him what this other doctor said. And he said, okay, he said, we will try, but inshallah, what can we do? And I said, I want to do this thing now. I want to do it. Let's start the foundation. Let's do it. We pulled together 4 roses and 3 tables at some place and had a party and raised some money within 15 minutes. Pulled all our friends to do it. And that was in April of 2009 when we started the EFA, and we had our first little charity event. And since then, I gave an interview to Newsweek.com when we did it, and a researcher named Linda Griffith at MIT happened to read the article, and she had been a lifelong sufferer of endometriosis and had hidden it from her colleagues because she didn't want to be passed up for tenure, or promotions or grants. She even had a couch installed in the women's bathroom, so she had a place in private to lie down. She had many surgeries, but reading this article, she said, made her want to do something about it. And at the time, she had gotten a MacArthur grant, a MacArthur Genius Grant, and she managed to cobble a few, this is her words, managed to cobble a few more $1 million together. That's how Linda Griffith speaks in those kind of terms. And they opened this research center. And so just because one person said something to another person, I tell you this story because I want you to remember those 7 people in these 7 days that you're going to tell about this disease, including, of course, any patient that comes across your desk that you think may need this information. So we started this organization in April 2009, and in June of 2009, he didn't even believe me at first. He thought I was being hysterical. He said, I know you want to be pregnant, but I'm sorry, I don't think you're pregnant. I said, no, I'm pregnant. And I got pregnant. I got knocked up the old-fashioned way. I really did, believe you me, I would not have done it the way I did it if I had a choice. But nonetheless, no matter how Krishna has got here, I am so happy she's here. A basic Google search will tell you all the gory details, but I digress. Basically, I think that me opening my mouth up and me being so pissed off about what happened to me and agreeing to talk about my vagina and my periods and my Tampax and my numb butt, to anybody who will listen, is what gave me the baby. Because I'm Hindu, so I am religious. I mean, I'm not religious really, but anyway, I do believe that if you pay things forward, that, you may not get immediately a payoff for doing your best or trying to right a wrong, but in the long run, you will get paid back. And just holding this mic today and having you guys all here on a Saturday when there's millions of things you could all be doing, I know, carving pumpkins, making soup, is thanks, because I really appreciate you guys being here, and I really want you to tell those 7 people that the face you saw here today is really just one out of 190 million faces. And, there was some, discussion about, who was really responsible for getting me pregnant. Dr. Sechkin was. I owe him, not in that way, Ella, she knows. But I'm serious. I am so lucky because I have this beautiful little girl, and I wouldn't have even probably addressed the situation if I hadn't met Dr. Sechkin. Never mind my illness, but even the notion of my fertility. Most of us are struggling with our careers. The young girls that you see in your schools, if you are school nurses, are going to be the same way. Our world is so fast, we're delaying motherhood and becoming a parent till our late 30s, early 40s, mid 40s. I spent my whole life trying not to get pregnant. Can you imagine what it was like to hear I couldn't get pregnant after all of that? And so, we think that we have a lot of time and we think we can push these things under the covers and in the drawer, but we cannot. And we need, as women, as professionals, as doctors, as citizens, and fellow human beings, we need to open our eyes to what's happening around us. And if you have anybody who comes across your window screen, that you think could be helped by any information you heard today, please open your mouth. If one doctor, one school nurse, one relative, one girlfriend had opened her mouth, maybe I would have gone to a Dr. Sechkin, if not Dr. Sechkin, many years earlier. And I want to see that poster that is out there. I want to see that poster in every girl's locker room, in every women's bathroom, in every health spa, in every facialist. I want to see a mini version on the back of every Tampax box. I want to see pages and pages and pages in every medical textbook of every medical student, whether they're in a nursing program or a doctor program, to understand endometriosis. So that even if I'm going to get treated for something else, that doctor can say, I'd like to explore this avenue, and if I can explore it with you, I'd like you to see somebody who can. And you remember that old Fabergé commercial? They'll tell two friends, and they'll tell two friends. Nobody remembers that? I'm that old? No, you guys remember. That's what I want you to do. And you nurses are our first line of defense. Nobody wants to go to the doctor, even less want to go to the gynecologist. I'm 43, I don't want to go to the gynecologist either. And I love my gynecologist. You know, so a young girl does not want to go to the doctor. That's why you nurses, who have much more influence than a doctor that she sees for 5 or 10 minutes, can help, can change a girl's life. If I think back on all those 4 or 5 days that I missed, you know, from going out with my girlfriends, from helping my grandmother, to learning a new recipe, to being at the gym, to being at the library, whatever. Think about how much more, not only I could have been enriched, but how much more my community could have been enriched by me. It's also a big wage loss to miss work and all of these things. You guys can do the math. Just want you to remember the 2 numbers I said. 190 million. That's just the people who have trouble with their period. That's not the people who are around those women and love them and have to make up their work at work, have to make the food that they don't cook, have to take the kid to school, have to do. And I want you to remember the number 7. 7 different people in the next 7 different days. Thank you very much.